Hello and welcome. I'm Dr. Raj, a practicing anesthesia doctor in the USA, and thank you for tuning into our live session on Ask the Experts. We try to do this every weekend. In the last year or so, staying home and maintaining social distancing has been the norm. If I step out of the house, buy few things, and come back home and then have a random sneeze, I'm starting to think, did I get COVID? There is a lot of anxiety, stress, fear, sadness, worry for everyone, which has led to serious mental health problems. This can happen to anyone, any age, and well known celebrities have been through this. We all know Robin Williams, who went through this. We have seen why we've grown up watching his movies, and Deepika Padukone, to name a few. Today, we are fortunate to have two mental health experts who will answer our questions and provide tips to improve mental health and well being. I want to welcome the live and returning viewers. If you're a returning viewer watching the replay, remember this is a long video because we tend to cover a lot of important things. You can always scroll to topics that are important to you in the video or by looking in the description below. Our first expert today is Dr. Divya Nallur. So welcome, Dr. Divya.
Hello, everyone. Hi.
Hello.
Hi, I'm Divya. I'm a psychiatrist. I practice in India, though I trained in the UK. So, hi, everyone. It's great to be here.
Yeah, so Dr. Divya is a consultant psychiatrist and co-founder of People Tree Marga Hospital in Bangalore, India. Dr. Divya, as she said, worked as a consultant psychiatrist in the UK, and this is our hospital for many years before returning to India. Our other expert is Dr. Zindadil Gandhi. Dr. Zinda, welcome.
Hi, good morning, everyone. My name is Sindadil Gandhi. I'm a psychiatrist practicing in Malton, New Jersey.
Yeah, so his clinic is Serene Psych LLC, and he practices, as he said, in Malton, New Jersey. I have left their details in the description below. I have to tell the viewers the most exciting part. Dr. Divya and I went to medical school or college together, and we are alumni of Bangalore Medical College. I know Dr. Zindadil, who is a great friend and is very active in social service. If you're here for the first time and still not subscribed, I encourage you to subscribe and hit the bell icon so you get an update when I release or I am about to release a new video. Hit the thumbs up like button and share this video so more people can get benefit from this. Do type your comments below if you have any questions, and I will try to get to as many as possible. And here is a quick disclaimer, and you can find this in the description below. If you want to come on screen and join live to ask a question, you can do that too. I will leave a link in the comments, and you can simply click on it, join, and ask a question. So, millions of people and children are losing out on many things, including their rights to survive. So many are stuck at home with social distancing. They cannot see their near and dear ones. So many have lost their family members and lost their jobs, which has put a lot of stress. So, Dr. Divya, tell us, how do people know they're having mental problems, especially with COVID 19?
So, like you said, Rajiv, a lot of people are having a lot of problems because of COVID 19. And mental health problems we expect will be the next pandemic after the COVID pandemic. So, what are the symptoms that you'd notice such that you need to see a psychiatrist? Anything that worries you. If you feel uncomfortable and you're not able to soothe yourself with normal activities, like you're doing your routine, you're doing your yoga practices, so you're doing all the things that normally soothe you, but it is not soothing you, then see a professional. There's nothing wrong with seeing a professional, even if everything is normal. So, all this professional is going to say is that you're just a little stressed and you can go back to normalcy. So, there's no stigma in seeing a professional mental health practitioner as soon as you think there's something wrong with you or your loved one.
Okay. So, Dr. Zinda, tell us, how do people know what is normal, what is not normal?
So, if anything, that becomes a routine, a change from routine. what Dr. Divya mentioned, that anything that is a prolonged issue, you notice the individual changing, having changes in the mood, having changes in the reactivity to the other individual, having changes in sleep or appetite, and such major changes in their daily life. And when they occur on consistent basis for days, 2 weeks, then it can be concluded that it is something out of the normal and out of the routine.
Okay. The other issue is people are always worried they can get COVID. This has increased anxiety. So, Dr. Divya, tell us how to manage anxiety related to COVID 19.
Okay. Yeah, everyone's scared of a lot of things in during COVID. And when we're worried about so many things, anxiety is a normal form of response. So, how do we manage the anxiety, living with the anxiety, and what we call developing emotional resilience? So, having the emotion but not making it affect our life. The best advice that we've been giving throughout this COVID period to all our patients and all general public as well is make sure you maintain a routine. Despite work from home, despite all the changes, make sure your routine is not changed. Sleep at the same time, get up at the same time, eat your meals at the right time. Make sure your exercise regime is at the same time. Make sure you are having relaxing leisure activities that you normally do. Socializing is a big part of human culture. And because we have decreased access to socializing right now, you need to make sure that it is compensated by other forms of socializing. So maybe Zoom calls to the family, Zoom calls to friends, and making sure you have contact with people so that you are describing your distress and you're also sharing their distress, which makes it all normal. So everyone's going through, we get the feeling that everyone's going through the same thing. It's not very unique to me, and
Mm-hmm.
that gives us reassurance and we feel better. So the main aim is trying to bring normalcy in the state of abnormalcy. So being as normal as possible in all aspects is the best thing to avoid anxiety. And obviously, staying away from repeated insults from media of how horrible this pandemic is. Get your news, but get your news in a brief, non traumatic way. Maybe read the newspaper once a day to know what's happening in your place, but don't let yourself get bombarded by the news and on WhatsApp and all other social media.
Mm-hmm. So, the media has certainly created a lot of stress on people. I think you very well said that.
Yeah, especially in India, we notice that there's a lot of fear mongering because media need content and media wants to sensationalize whatever is happening so that they have increased viewership, and this causes a lot of kind of trauma to the patient. Seeing other people's distress is not very helpful, and seeing other people's distress constantly is not very helpful to our minds.
Uh-huh. So, in spite of having all this, Dr. Zinda, so what treatment is available for people suffering from all these mental health problems that you and Dr. Divya just mentioned?
So the first step in the treatment is to identify whether is this a psychiatric disorder. It
Mm-hmm.
has reached to a severity that one should call it a disorder, and then the treatment is available. The reaching out to a psychiatric expert, psychiatrist, psychiatric nurse practitioner, or even a family physician or a pediatrician who do use multiple screens to understand the baseline is would be the first step. When family members are noticing certain changes which are happening on consistent basis out of the routine, that would be an indicator. Sleeplessness or increased sleep, isolation, mood changes, irritability,
Mm-hmm.
severe anxiety to a state of panic.
Mm-hmm.
These are the common symptoms that could occur. And if they recur or happen on recurrent basis, then it would be something that would indicate treatment. The treatment is then decided by an expert, whether it would require medication management intervention or some psychotherapeutic or other interventions.
Hmm. No, that's great. That's a very simplistic way of explaining things. Thank you. Uh, so my next thing is, what resources or different types of help are available for people? Obviously this is different in different countries, and we have experts, one from US, one from India. So Dr. Divya, if you want to mention in India, so what resources or different types of help are available for people?
Okay, there are a number of charitable organizations doing a lot of free counseling. The government's doing a lot by releasing a lot of information. So, getting your information, so a lot of anxiety is about not knowing.
Hmm.
So, getting accurate information from uh, good sources of information. So, go to COVID websites released from by the government and get your information, whatever information you're seeking. And then, that's called psychoeducation. Educating ourselves about whatever we are worried about decreases the anxiety in itself to a degree. And then there are lots of charitable organizations doing a lot of work, free counseling, one to one. A lot of these are online or on telephone consults. Nimans has one. Yeah, I think you get screens saying, giving out numbers. But if you just Google help or free help for anxiety, depression, or any COVID related concerns, you can get a number of numbers. The government itself has a helpline that you can call. And there are, I mean, as you know, Rajiv, in India, we do a lot of private practice as well as public sector services. So all the private sector practitioners are available to you. There are immense number of psychologists, counselors. So you choose what you want. I mean, get diagnosed. Don't hesitate. The biggest problem what we see in India is the stigma associated with going to a mental health professional or even calling a mental health professional line. So the urge to or anyone who's listening to this is do not hesitate. Access. There is enough help out there. Please access whatever you think is appropriate. If it's not appropriate to you, they will just redirect you to the right source, right resource. So yeah, do not have any hesitancy in accessing these uh, services that are available.
Okay, that's great. So I did show the crisis or the India helpline number on the screen, and I am going to leave the description, leave that number in the description below. And Dr. Zinda, if you want to mention about the resources in the US.
Sure. In the US, the resources are widely divided in two: the central resources, which are available throughout America, and then there are local resources. The central resources, as you're describing, it's a National Foundation of Suicide Prevention. They have a 24/7 helpline as well as the talk and text services available. Who anybody is in a severe crisis or feeling severely depressed or even suicidal can call this number and get immediate help. Then there are national organizations like American Psychiatric Association, American Academy of Child and Adolescent Psychiatry, National Alliance of Mentally Ill, NAMI, and other agencies who also have information available online. They have a lot of videos that help individual understand what is normal, what is abnormal, and what type of services are available and resources are available. Then there are local help, local resources. The local resources are usually dependent on the county resources. So there is a county mental health clinic, which the information can be found online depending on the individual's resident county. And as Dr. Divya mentioned, that in America as well, the mental health services are widely divided into community mental health clinics, which are usually supported and run by organizations like Rutgers University, other community mental health organizations, as well as private psychiatric practices, which could be found online based on your residence.
I know you did share me the crisis number in USA, which is 1-800-273-8255, and text talk to 741741. And this is displayed on the screen right now, and I will leave this in the description below as well. So since this is especially a problem in India and other low middle income countries, since mental health problems is still believed to be a taboo, who is the right person to contact if someone thinks they have a problem? Is this the regular doctor, a psychologist, psychiatrist, or someone else?
Okay. So the best thing to do is go to your local GP. Usually in India, though the general practitioner services are not completely organized, but most patients know a doctor in their own locality who kind of they have gone, the family has gone for years too. So going to them and describing the mental health problem may and then asking them where is the best person to where is the best place to go to may be the first thing you do. But do you go to a psychologist or a psychiatrist, because all of these are available in private sector, and you can choose to go to anyone in India. There's no hierarchy. You don't have to have been seen by a psychologist before you see a psychiatrist. So just to briefly explain what a counselor, a psychologist, and a psychiatrist do, a counselor is may have done a BSc in counseling or a MSc in counseling, and they do not have a lot of clinical knowledge about illnesses, mental illnesses, but just about social distress and interpersonal distress. So, if that's the kind of things you're struggling with, you can go to a counselor. A clinical psychologist is someone who has done BSc in clinical psychology, MSc in clinical psychology, and they can kind of diagnose to a degree a mental illness or can see the presence of a mental illness, but they can only give psychotherapeutic interventions, as in talking therapies to you to manage. So, if you have anxiety or depression, how do you get over it with talking therapies? And a psychiatrist is an MBBS doctor, a doctor who's done their MBBS and then have gone ahead to specialize in the field of mental health. And they are the ones you'd need to see if your mental health is bad and you think that there is a mental disorder, and they are the only ones who can prescribe medication. Obviously, psychiatrists don't just put you on medication, they will also deal with psychotherapeutic interventions. So it's severity which leads you to a psychiatrist. For milder interpersonal social things, you may just go to a local counselor.
Okay. So, fortunately, in the US, I don't think it's a taboo to have mental health, although I'm not aware of that. But is there any differences in the US, Dr. Zinda?
In US, there is, of course, you know, it also varies in terms of individual who are psychological mindedness and are able to understand the symptoms very quickly. For children, especially, being a child and adolescent psychiatry, what I would mention is that uh, in US, the pediatricians do routine screening on children and adolescents. They have certain NIH, National Institute of Health, recommended screening questionnaires that help them understand some anxiety, depression, or some other psychiatric condition or psychological issues that they can pick up on children and adolescents. And then they have a referral resource that they can refer the children and adolescent to a psychiatrist or psychologist or other therapists.
Mhm. So, a lot of people have lost their loved ones during this COVID-19 pandemic. So, Dr. Divya, tell us how to deal with the loss of a loved one during this pandemic.
We are facing a lot of problems with grief and bereavement during this COVID period, especially in the second wave of the pandemic. India has experienced immense amount of loss because maybe because we didn't lock down quickly enough or whatever the reasons. We have seen a lot of deaths and a lot of bereavement. So there is a process of grief and bereavement that every individual goes through. And each individual has a very unique grief and bereavement process.
Mm-hmm.
So there will be a period where you may not believe that the person is already gone because it's so sudden and so acute, and it was not expected. And then that might turn into anger and a lot of emotions and mixed emotions and disbelief can be a part of the grief process. Allowing the person to grieve is very important. And in India, we have beautiful cultures to enable bereavement and grief and process that whole process. Our rituals are rich in, cultural support, everyone coming together, performing things, and, explaining, priests explaining to us how they've gone to a better place, our loved one is in a better place, and that there's no pain wherever they've gone, or whatever it is. But unfortunately, because of this pandemic, the whole system is shaken up. A lot of the times we're seeing that people have not been able to bury their loved ones. They have had to cremate when actually their culture is to bury the person, and they have not been able to do rituals in large groups, like which is normal in India, where you can talk about your loss, and there is general therapy happening during the rituals. All this is lost. So having a new system for managing bereavement is very important. And one of the biggest parts which is missing right now due to COVID, which is needed, is mental health support, be it from family members, be it from your extended family members, be it from friends. It is very important you seek out that support that you need. And if it becomes prolonged, if it's not going away, if you're not able to deal with it, if you are getting overwhelmed with the grief or bereavement, please find a mental health professional and get some support. It's also important for others to notice people who are bereaved. So people who are bereaved may not be able to, assess themselves as being in abnormal grief or abnormal bereavement. So it's very important that if you know someone who's lost someone close to them, it's very important to keep in touch with them, even if you can't go visit them because of the lockdowns and stuff. Please call them, make sure they're okay. Constantly check on them, give them support, hear their story, hear their emotions as much as possible. And if it becomes unbearable, overwhelming, please contact a mental health professional.
Mm-hmm. Okay. So I have a question from the audience that says, I have COVID-19. I guess, how do I tell the people I was around? So probably because, they're stressed about COVID-19, or, there are a lot of things going around. So do you have any suggestions for that, Dr. Zinda?
I think what I understand the question is that if one individual has COVID 19, like one is COVID 19 positive,
Mm-hmm.
then how they say the people who they were in contact with. I think that's
Mm.
what the question asks for.
Yeah. So
I think
probably
that
because
in
there is so much
America,
of.
in US, we have a contact tracing. So there are individuals who are assigned to do such. And uh, if you were, if you are in a contact with somebody, it becomes kind of I think a social obligation to let the individual know that I have been in touch with the somebody who is positive. Now, if routinely, if you are in a contact with somebody who is positive within past 2 weeks, you can get your own testing done to understand if you are positive or negative. And there are protocols to follow suggested by the CDC that can be easily found online.
Okay. Thank you. And we talked about losing a loved one, and a lot of people have lost their jobs, and it's only getting worse. So, how do people deal with their job loss, Dr. Divya?
Right. So bereavement or grief is in the COVID period has not been only about losing people. It's about losing a lot of things. It's losing the job, losing social contact with friends, uh, losing, you know, a lot of things, financial security, losing touch with maybe extended family. So there's a loss associated with the COVID pandemic. And losing the job is a tremendous problem in India, of the financial distress, because we do not have very sound social systems which will protect us when we lose jobs. And, especially in a pandemic, when if you do get ill, you'll need money to for hospital bills and stuff like that. So it is a big loss with loss of jobs, and a lot of people have gone through it. But the important thing to differentiate is, when I worry about a thing, am I worrying about something I can control, or am I worrying about something I cannot control? The pandemic and the situations around the pandemic, as in poorer job supply in the market, lesser job opportunities, is something I cannot control. So, and worrying about it is useless. So, finding a way, it's easier said than done, I know. If I don't have a job and I'm worried about where my meal is going to come from tomorrow, then there is no other way but to worry about it. But there are a lot of government schemes. What you need to do is, it was very interesting how I treat a very old man. He brings his wife to clinic, and he had come in the first wave of pandemic, and he had come, and I was saying, oh, it's really sad, what the pandemic is really bad. And he's in his 80s. He brings his 70-year-old wife, and he said, I don't know what your children are mourning about. When we had a pandemic, he was talking about some pandemic
Maybe
when
Spanish
he was
flu.
young. Yeah, maybe Spanish flu, or he was talking of the war. It was a while ago anyway. He said, we did not, no one had food to eat. And these British or American helicopters would come and just drop food packets, and you had to go find a food packet quickly. And it used to be this tin, I think it's some high protein, high nutritious food. And you had to open the tin and just lick it till the next packet comes.
Mhm.
And we survived that. But you're sitting at home ordering on Big Basket and Swiggy, and you're all okay. Why are you panicking so much? Is what he said, which made a lot of sense. All we need to do is survive the pandemic, even for someone with very minimal. I mean, I see people with money as well panicking.
Mhm.
So the panic is not just about people who have lost jobs, who are financially insecure. But I can understand, if you're financially insecure, how it can cause you more anxiety. It is very important to keep in mind that life's more important than anything else. You will get back a job. You will make up for the money loss. You will do everything else. It's just going to be delayed by a year. And that's a thing that you need to keep in mind, and focus on, how do I survive this pandemic? How do I not lose it? How do I keep my mental health sane? How do I keep myself physically safe? And focus on day to day things, live each day as it comes, and it will get back to normal. And all of us are in the same boat anyway.
Mhm. Okay, thank you. And Dr. Zinda, how is it similar or dissimilar in the USA?
In the USA, there is also a lot of job loss, as we know that there is unemployment going on. There are small businesses, independent businesses which are closing. So it is a very difficult scenario, especially those who have a longing or attachment with such businesses and places. What is happening though is, the U.S. government has released so many packages, financial packages, to help small businesses. One is called the Payment Protection Plan loans that help the owners, business owners, to pay certain monthly payments to their employees to keep the employees in. As well as there is social security, unemployment benefits, etc. All this information can also be received online by visiting the local social security offices. However, as we are aware that in United States, the population vaccinated is increasing, and the government is releasing certain restrictions on hygiene and health mandates. So that is allowing individuals to go back, open up certain businesses, go back to the normal routine. So the difference in America is that I think the degree of vaccination is helping to getting back on the normalcy.
Hmm. Okay. So a lot of people are complaining lack of boredom, lack of socialization, and there is a risk of people getting into substance abuse like smoking, alcohol, drugs, and you name it. There are so many of them. So how can people take care of themselves and prevent from getting into all these things that they should not be doing, Dr. Divya?
Yeah, stress causes increased chances of us going into bad coping mechanisms. We need to be very careful that we use good or better coping mechanisms and not unhealthy coping mechanisms to manage stress. So, some of the unhealthy coping mechanisms is boredom causing them to stay up all night, watch Netflix all night, and then change their circadian rhythm, or use smoking to kill boredom, or use alcohol to get to sleep. Yeah. So we have seen an increase in addiction rates. So people who have previously been addicted and who had managed to maintain abstinence for a while have gone back to addiction because they have more time on their hands. They have less things to do, and they have less socializing. But we've also seen the opposite, where in the first phase we did not have easy access to substances, which meant that there was a lot of withdrawal symptoms. So people who were addicted did not get their addictive substance, and they got severe withdrawal symptoms. So, how do we manage this? Is to, like I said, managing anxiety or mental health problems in this pandemic, we have to make sure that we bring a degree of normalcy into this abnormal situation. And the way to bring normalcy is to use technology, and also to make sure our routine is as close to normal as possible. So, insisting that kids, teenagers, sleep on time and get up on time despite not having school or college. Insisting that you get up and take a shower despite you don't need to go and socialize with anyone in the office. You still need to shower, change your clothes, and make an effort to look good.
Yeah.
Not just look till your face, but look good all the way down. Yeah, so keeping a routine, and keeping an eye out for bad coping strategies, and trying to have better coping strategies. So what are the better coping strategies? Socializing online, or maybe taking up a new hobby, music, art, eh, or sport. I know you can't do a lot of sport, but you can still exercise on your terrace. Do 12 Surya Namaskars every day. Just create something that is doable even in this difficult situation.
Hmm. So, shifting a little bit of focus on children, Dr. Zinda, tell us, is there anything that's different in younger children and teenagers? I mean, do they show any different symptoms, signs?
So it is a very challenging time for this particular age group. Children, adolescents, young adults, they are all supposed to be out, socializing, out, doing a lot of physical activities. The general school structure is such that they are allowed to get all that exposure. The school is not just for academics, right? The school is also for socialization, learning social cues, learning communication skills, learning many trends, physical activities, arts, music, all those things. When the COVID hit, everything suddenly stopped. We have some data that is coming out on the effect of COVID on pediatric population, and of course, more data will come out. But there is clarity that with not everybody, not every child is able to adjust to the demand of virtual learning or remote learning. It is very common that kids are having difficulties staying still in front of a 14-inch computer. The families have challenges, the school have challenges, technical challenges that the kids have to go through, and they are still expected to perform at the academic level. So that has created, I believe, a tremendous challenge. And of course, as the time goes on, we will be able to get more data on the effect of it. But there could be a developmental shift that we may see in the generations who have experienced the COVID, pediatric generation. Uh, the common symptoms, the common presentations that come in clinical practice, though, is most common is the resistance. Children, even adolescents, high schoolers are suddenly resisting academic. They are not doing their homework. They are not performing. They are resisting, which many times for parents is difficult to understand this switch when the symptoms were not present prior to COVID. Um, the other symptoms are irritability, defiance, opposition by child towards parents and towards other authorities. So there is absolutely a very difficult time, and this is how the children are expressing their difficulties in adjusting to the time. However, in America, as the schools have ended or would be ending by the end of this week or next, now the challenge is how to keep the kids active in the in an environment when there is no boundaries or no structure of schooling. I think in that case, what helps is, as Dr. Divya mentioned, to expect some degree of routine. You wake up at certain time, you get ready, and you have certain activities done. The parents can take the help of communities, as well as certain other academies. Maybe school can provide certain activities. Some children qualify for summer activities in the school, whereas some children parents can manage such activities through the community resources and have a day that is somewhat structured, that children know what their expectations are, what they would be spending the day in, and then routine meal times, routine activity times, and routine bed times that really help children to cope up with these changes, and then getting them ready for the next academic year, in which we hope that the schools would be back in with the other curricular activities, extracurricular activities as well, which are very important in otherwise pediatric development, not just academics.
So, all three of us have young children, and we are obviously worried about our children. So, as parents, what can we do to help our children? Dr. Divya.
Yeah, like we've been saying, having some form of structure, obviously not as structured as a normal school day, but having some kind of structure, giving them enough playtime and free time, but giving them also some structure so that they have some meaningful activity, they have some sense of achievement throughout the day. And I think it's a great opportunity, this one, for us to create some life skills. So when it first started, I made a list of things that my child had to learn in the pandemic. It was things very simple, like you need to learn to make tea for mommy. You know, that's a life skill. You need to learn to iron your own clothes or fold your own clothes. So an activity can be as simple as that. Or you need to learn to, if I'm a working mom, so I have to leave the food on the table and have to go away. So serve your own food, but tidy up after yourself. Put some things for washing. So depending on the how old the child is, make a list of the activities that they need, like maybe sew a button on. Yeah, so small things like that can fill a child's day actually, because it's very simple things they need. I mean, obviously, like Dr. Zindadil said, there's a lot of resistance in this generation kids. You're like, why the hell do I have to do that? Especially in India, if you're from a reasonably affluent family, there's someone to do it. So why do I have to make tea? Why can't someone else make tea? So there's a lot of resistance, but I think it's rolling with that resistance and, working with that resistance, but continuously trying to structure their day to a degree at least. The one thing that has been very concerning is the amount of time where they're spending online without adult supervision, which is I'm really paranoid about, and especially because I also see it in clinic all the time that there's a lot of danger online, and kids are not yet very fully aware of those dangers, no matter how much you educate them. So it was very easy when we were growing up. My parents were working, but summer holidays meant I was on the road. But there was a whole road looking out for me. A whole road of neighbors knew where Divya was at 11 o'clock if my mom needed to know it, even without phones, even without, because there was a sense of community and there was everyone looking after, and it was okay. But online, it's so difficult to find out who are they talking to, what are they doing, and especially if they're in their tweens or teens, it's an impossible task because you want to give them a level of privacy, but you're also continuously paranoid. We have seen increasing numbers of like possible grooming and you know children making friends with people they don't know, which can be quite dangerous online. So those are the risks. So having a constant dialogue with your child, if you have a teen or a tween, constantly educating them and having their trust. So my so that if even if you murder someone, I need to know. I'm not going to save you from going to jail, but I'll get you a good lawyer. And he keeps making fun, saying, "Why the hell will I murder anyone?" No, that's not the point. The point is, it doesn't matter how much deep in trouble you are. You need to talk to me about it. And having that open dialogue with them, giving them some purpose in life every day is what is very critical, I think. And I think they'll hate us for it, and that's okay. I mean, I think every child, there's a saying, isn't it? If your child doesn't hate you, then you're not being a good enough parent. So, so at some point they're going to hate us, but well, that's what we opted for when we had those children.
Yeah. Well said. When it comes to resistance from children, it's not an Indian problem. I go through that every time. So tell me about it. So Zinda, you were contacted by an NGO in India who said, a lot of kids have been orphaned, and which is actually the reason, why we came up with this idea of doing this special mental health session. So is there anything you want to say about that?
So it is, it is tragedy. It is a fact, and there is no escape from that. As we discussed that, as Dr. Divya mentioned earlier in the session about how to process the grief, what as I discuss, I continue to remain in a discussion with the counterparts in India and their representatives in America. What I'm realizing that the strategies that they are implementing and are helping is to, of course, provide first of all provide resources, making sure that they are safe. The safety by providing them shelter or maintaining the shelter, maintaining some basic needs, food, safety, as well as then the activities for children. The activity, keeping them active, is very important. The way they process grief is different. It depends on their developmental stage. Certain age of children, they believe that the loss, death is not permanent. They believe that it's the person who has died will likely come back. So they are going to process the grief very differently than a preteen or maybe a teenager who start understanding that the loss can be permanent, versus the late teenager who also processes it very differently. So providing them with activities. So the interventions that are happening or are attempted are providing them online resources in which the kids can group together and occupy themselves in a particular activity together, like sometimes art, music, dancing, singing, if they share similar language and culture background. Those are the activities that, when done on repeated basis and regular basis, that they also develop an expectation on, okay, this is how my day is going to go, is very helpful. So that is being attempted. And based on their age group, the education resources are also being provided. Now, if there are schools, then of course a lot of activities can be done in school, but as if it is a summer break or individual is at home, then at least for now, using the online resources platforms like Zoom or other activities, watching certain YouTube videos who provide entertainment, education, or simultaneous training on arts, music, etc., can
Like this
really
one.
help. Yeah, yeah. The other thing is that children really do well with a lot of physical activities, and if, depending on the geographical location and the availability, if they are allowed to go out and be a part of the nature. In America, we have trails, we have state parks, we have national parks, um, we have biking trails. It really helps that children participate, children go out and do such activities. Parents can participate, parents can help with that as well. I would like to add one more thing on what Dr. Divya mentioned in terms of the social media exposure. That is absolutely a challenge right now to all parents. How to monitor, how to limit the exposure of social media to children. One way it can be attempted is to maybe doing activities with them. If kids are interested in certain video game gaming platforms or coding platforms, if the activities could be done with them, if there are certain games that have coding as integrated in the practice. There are certain games or apps that allow kids to do those activities outside, that can be attempted as well. Um, if parents are able to carve out some time on regular basis to spend time with children, not necessarily doing the activities they wish their children do, but also to just participate in the activities children are participate doing that time, that can help create a more consistent and stable bond with certain parents who are especially noticing the difficulties, the defiance, or the resistance increasing from their children.
Hmm.
And of course, as parents, the media time and screen time can be monitored and can be minimized as well. Some shared screen time, as like movie time or TV time, can also be done, in which the parents can shift the focus to something that could be educational or something that could be entertaining for the whole family. That can also help.
Okay. Well, I know Divya, you had a long day of seeing patients. I know Zinda, you have patients waiting for you. So I just want to ask one last thing. Divya, if you want to say, can school teachers do anything to recognize problems in children? Because we know kids are going back to school.
Yeah, I think school teachers have a lot to do with recognizing symptoms of mental illness in children. They are, they probably see, once schools open, they probably see children for the longest period of time. Though they spend more time at home, a lot of the time is gone in sleeping or showering or eating. But actual behavioral concerns can be first seen only in school environment a lot of the time. So it's very, very important that teachers are very well aware of, mental health issues that can come up, and they are sensitized to, not criticizing the mental health problems, but to, offering help or support to these mental health problems. It's very, very important that if a child is showing any kind of distress or any kind of irregular behavior, any change in normal behavior, that is taken as a concern and investigated properly within the school and also with the parents as well. Because any change in behavior can directly link to some mental health issue in the child. So, unless it's investigated, we don't know. My professor once said that every time you see a person showing distressing behavior, it may be banging a door or you know jumping up and down, acting like he is very angry or upset. But you always think of a fish who's got caught in a fish hook, or a fish hook caught in a. So the fish just looks like, to other fish, it just looks like it's just jumping up and down without reason. There's no reason for this fish to jump up and down. But unless you find the fish hook and remove it, there's nothing you can do. So when you see a fish in distress or a child in distress, you look for the fish hook, and the teachers are very, very crucial part of trying to find what the fish hook is.
Hmm. Okay, no, that's great. I want to remind our viewers, if any of you want to see these experts, Dr. Zindadil Gandhi is actually in Malton, New Jersey. This is his beautiful office, and he has created a very nice logo. I love the logo. And if any of you want to see Dr. Divya, so she works in Pre-Poultry Marga Hospital in Bangalore, and this is the registration desk, and I'll leave all this information in the description below, so you can always look it up, and if you need to contact them, you can always go from there. So I want to thank you, Divya and Zinda, for taking your time talking to us, educating us. I'm very thankful for you to do that.
Thank
Thank
you
you,
very much
Rajiv.
for having me.
It was a pleasure.
Thank you.
Yeah, thanks.